Opioids are a common and necessary treatment for moderate to severe restless leg syndrome when other treatments that are considered first line have failed. But what would be the 10 most common or worrisome side effects of people who might be taking opioids for restless leg syndrome? I'm Dr. Andy Burkowski of ReLACS Health. Now, opioids are caught in the war on drugs, the war on opioids. 100,000 people are dying of opioid poisonings in the US annually. So these drugs are a major concern. The medical field has become very anti opioid. The spectrum has swung from doctors prescribing it like Halloween candy now to patients no longer being able to get opioids, even if they're in severe pain, or particularly in the case of restless leg syndrome, if this is the best option for their treatment. People must weigh the risks and benefits of every drug. Drugs are neither good nor bad. But in the case of opioids, which are necessary when other treatments like iron infusion, lifestyle and sleep changes, alpha 2 delta ligand medications like gabapentin and Lyrica, if those treatments have been tried and don't work, many patients with severe restless leg syndrome have no choice but to be prescribed opioid medications. So, what are the 10 risks that they should be concerned about? Well, number one, and the biggest one, is respiratory depression. Those opioid related poisoning deaths are due to the fact that most opioids affect the breathing centers in the brainstem. So, if somebody who isn't used to the opioid takes too much suddenly, that could cause the breathing to slow down, and therefore that could result in coma or death or another terrible outcome. Buprenorphine, in particular, appears not to have much of an effect on breathing due to its unique mechanism, but most of the full agonist opioids, like methadone, oxycodone, hydrocodone, etc., can do terrible things to the breathing centers of the brain. And this really is a huge concern, particularly in patients taking other drugs that slow breathing down, including sedative hypnotic drugs like sleeping pills, benzodiazepines, and other drugs that slow breathing. So this is a huge concern and one to be monitored carefully for, particularly if other conditions exist like obesity and sleep apnea that is untreated. Number two is drug abuse. So that's one of the big concerns why doctors are hesitant to prescribe opioids. Drug abuse tends to be more specific to the personality type, the social situation, and other factors that are pertinent to the individual and not so much the drug itself. So these must be weighed by the clinician prior to prescribing opioids. Some people are just going to be at high risk, but there are tools like the opioid risk tool that can help a patient and a doctor evaluate whether opioids are a potentially risky treatment for that individual. In the case of restless leg syndrome, the studies have shown that the risk of abuse is extremely low. And in this particular condition, restless legs, it does not appear that abuse is very likely, but it should be looked out for as it is a potential concern. Number three is dependence. Dependence is where you require the drug to maintain the status quo. And if you suddenly stop the drug, you would go through withdrawal from not having the drug. This sounds worse than it is, but it's actually a little less concerning. Fortunately, opioid withdrawal does not typically result, it's terrible, but it does not result in death or most harmful consequences like some other drug withdrawals, but it can be avoided by tapering off of these drugs slowly. Dependence does not happen with all opioids. It depends on how long an individual has been on the opioids and what the strength of the dose is. Again, buprenorphine tends to cause less dependence, and longer acting drugs like methadone may also cause less dependence. But abruptly stopping an opioid could potentially lead to withdrawal symptoms and must be done carefully under medical supervision. But this is another concern. Number four is just the general short-term effects of opioids, which can lead to things like impairment or dizziness. If you have too much opioid in your system, it could be unsafe to drive. There could be issues with walking or coordination. Some of these symptoms can get better with lower doses or being on the medication for a few days and getting adapted to those side effects. But that is a potential side effect that makes opioids hard to tolerate. Number 5 is combination of symptoms that are usually short-lived, which could include nausea or even itching. Opioids do affect the brain and can cause different symptoms that may make it unpleasant to take the medication. Some of these can last for several weeks. Some of them might happen after a few doses and then basically go away once the body adjusts to those side effects. But those are things to watch out for. Now, moving to more long-term side effects, constipation is one of the big ones, typically not a severe side effect, but definitely one that needs to be addressed because the opioids can slow down the nervous system, which cause the bowels to move, and slowing down the bowels can lead to constipation. And this could cause sometimes more serious complications if not addressed, with stool softeners, increasing fiber in the diet, and if really necessary, certain medications to move the bowels, or even medications that can reverse the opioid effect of the bowels being slowed. But mostly this is very manageable with some changes to diet and stool softeners and adequate hydration or adequate intake of water. Number 7, depression is a bit of a concern. Opioids with long-term use can be linked to a slight increase in depression, so mental health should be monitored at all times with long-term use of opioids. Number 8 is effects of the endocrine system on things like reducing testosterone levels. So people who are on opioids long-term, if they develop different side effects like fatigue or loss of sex drive or libido, and other effects that may suggest that things like testosterone levels are low, they can discuss this with their provider or maybe their primary care doctor and get their testosterone levels evaluated and potentially treated if that were the case. But this is one of the side effects to watch out for long-term with opioid use. Number 9 is particular to forms of buprenorphine. As I've spoken about elsewhere, buprenorphine, when taken through the mouth, can cause a slight increased risk in things like dental cavities or tooth decay. So it needs to be handled in an appropriate manner, monitored very closely by one's dentist if taking one of these buprenorphine films or tablets through the mouth. Number 10, and the last one we'll discuss today, is particular to methadone, is that methadone, but more at high doses, can cause slowing in heart conduction, something called the QT interval. Now, in combination with other drugs that affect this QT interval, methadone could cause a serious slowing in heart conduction that can be concerning. So that should be discussed when patients are on higher dose of methadone, and often an electrocardiogram or EKG could be done to determine that QT interval and whether it would be safe to take methadone. But again, this is more on higher doses. Those on methadone for restless leg syndrome tend to be on very low doses of methadone where this is not much of an issue. But this would be another thing to be aware of when taking methadone for restless leg syndrome. And those are probably the 10 most common that will come up in the course of treatment for restless leg syndrome. So these are things to keep in mind, but overall, one must always weigh the risks versus the benefits of any treatment. And as I mentioned at the outset, opioids are indicated for moderate to severe restless leg syndrome when the primary treatment approaches have not been successful. Depriving someone of a treatment where otherwise the risks are not outweighed by the benefits is quite unfortunate, and many patients are suffering needlessly with this condition when opioids are a valid choice. But it should be done under very close supervision given all of the potential side effects and risks. As always, this video is for general information purposes only. It does not constitute the practice of medicine, and all of these medical decisions should be made individually with the care of a licensed medical professional. One of the keys to sleeping well, as I always like to say, is to relax.